My name is Emanuel Singleton. I'm a nurse practitioner with a Doctor of Nursing practice degree. What I love about being a provider is I have the opportunity to be a part of someone's life. I get to hear their story, the things that they've been through to get them to the point that they are at now. And I can help them progress further in their journey of life. When I see older adults, there's a lot of fear. That fear is the fear of the unknown. They don't know what's going to happen next. When they're experiencing changes in their emotion, I think the first thing I would tell the patient is just decide to talk about it. You can say something such as, I feel off today. That usually starts the conversation. Another thing you can do is talk to your family members, talk to a therapist. When I talk to older adults who perceive they're having a loss of independence, I try to talk with them and tell them it's the opportunity to evolve, it's the opportunity to learn something new. You still have a purpose, you still have things you can do. For older adults that are experiencing physical changes, such as the decreased ability to ambulate or walk, also the potential increase in pain, which could be affecting your mobility, it's still important to try to stay active. It can be light weights, it can be chair yoga. There's so many things that you can do to stay active. For older adults who are experiencing changes in their memory, the first thing I want to talk with them about that this change, it happens to a lot of us. It doesn't mean that there was something that you did to cause this condition. So when we talk about brain health, of course we always start with nutrition because that's actually the key starting point for good brain health. But then we also talk about keeping your mind mentally healthy, mentally active. So you want to get your brain exercise. So some of the things we talk about is being social, just talking to people, still keeping that connection. Then there's also things like puzzles, learning new things, learning new skills, new hobbies, reading new books. All of those things keep your brain active, keep it flowing. Opening up allows us to create a space for others to actually come join us in that journey or that change that we're going through. So an example is if you were to open up, now your family members know that you're going through something so they can offer the appropriate support. Opening up lets your medical provider know that there's something different so we can talk through it or get the right services or have the right conversation in place. But if you stay closed, we may or may not know that the condition is there. Going to see your provider for your annual physical, your vaccinations, your lab work, and talking to them about the conditions that you have are very important, and see what might be over the horizon and try to work on a shared plan to try to circumvent those type of things or help you to get over that hurdle. You can bring your family member to the appointment with your primary care provider, and these conversations can be had as a group or as a team because you're not in this journey alone. As we get older, there's a lot of tough conversations. Sometimes those conversations never happen because they are difficult. Some of those conversations are a living will. What are my wishes? Right? A healthcare power of attorney. Who is it that I entrust from friends and family to help make those decisions when I'm unable to make those? Of course, there's the financial aspects. How do I want to be taken care of as I continue this journey of getting older? And some of the more difficult conversations is, if I could not take care of myself at home, where would I want to be? And who can I get to help me with it? Some of the pillars that I believe as we get older is, as a rule of thumb, stay active, eat well, stay connected, don't be afraid to ask for help. When it comes to all of us with aging, is to remember this is not the end. This is just the new chapter. This is your time to do something new. There's help out there All it starts with is just talking to one person. Talk to your primary care provider. Talk to your family members. Talk to someone from your church. Talk to someone at the community center. Just talk to someone and start the process. So it's not just healing, it's actually the process to continue moving forward with a productive life.